I yield to the gentleman.
Mr. Speaker, I rise to share with you stories of real people and how health care impacts real American lives every day. One of my constituents from Westminster, Colorado, Barbara Graham, contacted me the other day and shared her story that I want to share with you. In 1970, Barbara's daughter was born with cystic fibrosis. The longest period of time she went without being hospitalized was 7 months. At that point, they had insurance, and Barbara told me that unlike today's insurance, it covered all of her stays and it didn't cost them an arm and a leg. Unfortunately, her daughter died 6 weeks before her 8th birthday, and her son was born with cystic fibrosis in 1976. He's still alive, but because of his condition, today he has no health insurance. He's self-employed, and he couldn't begin to afford the cost of insurance with a pre-existing condition like cystic fibrosis. His and his mother, Barbara's, daily thoughts are how long can they get help from the Cystic Fibrosis Foundation, from family members trying to patch together what they need to help with his medication and his needs. How long can her son stay healthy enough not to be hospitalized? His hospital stays have cost him everything. He can never accumulate assets. His hospital stays wipe him out. The last time he was sick, he was turned away. His mother's watched him where he can hardly get a breath of air without thinking that it might be his last. Yes, Barbara tells me, our country needs help with the healthcare industry. Barbara says that having an illness and a pre-existing condition is not elective, and it's a shame that insurance companies control how and when a person is treated. Barbara watched and how difficult it is for any parent to watch one of her children die because of our healthcare system, and she fears, and she writes, that she will probably watch her son die before his time because of his ability to access healthcare. Barbara wants us in Congress to remember those who can't help themselves because of illness. Well, in the healthcare reform plan before us, we ban pricing discrimination based on pre-existing conditions. Through creating exchanges, we allow people like Barbara's son, who are self-employed, to have access to a low-cost option with some of the same negotiating leverage that a 10,000 or 100,000 person company might have through an exchange, which allows for great choices between many private insurers and the public option. He would also receive affordability credits depending on his income. For an individual, up to 300 times poverty, up to about $42,000 a year in income, Barbara's son will receive affordability credits to buy the insurance that he needs through the exchange, which will be affordable because they won't be able to discriminate based on his pre-existing condition. It's for families like Barbara's, and to make American families stronger, that the United States Congress needs to pass health care reform. Thank you, and I yield back to my friend from Minnesota.